This class is on complete denture occlusion. Occlusion is defined as the static relationship between the incising or masticating surfaces of the maxillary and mandibular teeth or tooth analog. According to Hartwell, it is a static position of the jaws that can be either in centric or eccentric relation, and every time the teeth contact there is a resultant force which may vary in magnitude and direction. Centric occlusion is the relationship of the mandible to the maxilla when the teeth are in maximum occlusal contact, irrespective of the position or alignment of the condyle disc assembly. Eccentric occlusion is an occlusion other than maximum intercuspal position. Balanced occlusion is the bilateral simultaneous anterior and posterior occlusal contact of teeth in centric and eccentric position. Now, what are the requirements of complete denture occlusion? As per Winkler, the stability of occlusion in centric relation and in areas forward and lateral to it is important. Balanced for all eccentric contracts on bilateral positions for all eccentric mandibular movements is very critical. Unlocking the cusp mesiodistally to allow for gradual but inevitable settling of the bases due to tissue deformation and bone resorption is also needed. Control of horizontal forces by buccolingual cusp height reduction according to the ridge resistance and interridge space is very important. Functional lever balance by favorable tooth to ridge crest position is another significant element. The cutting and penetrating and shearing efficiencies of the occlusal surface should not be compromised. The anterior incisal clearance during all posterior masticatory function and bruxing activity must be of clearance, and minimal occlusal contact for reduced pressure in comminuting fluid is important. Sharp ridges or cusps and general Lewis ways to shear and cut foot with minimum occlusal force is required. What are the requirements of incising units? The incising unit should be sharp in order to cut efficiently, should not contact during mastication, should have a flat incisal guidance as well as considerable aesthetics and phonetics must be imparted, should have horizontal overlap to allow for base settling without interference, should contact only during protrusive incisal functioning. The requirements of working occlusal contact should be efficient in cutting and grinding, should have decreased buccolingual width to minimize the occlusal forces dissipated to the denture bearing areas, should function as a group with simultaneous harmonious contact at the end of the chewing cycle and during eccentric exertion, should be over the crest of the ridge in the masticating area for lever balance, should have a surface to receive and transmit occlusal forces vertically, should center the workload near the anteroposterior center of the ridge, should represent a plane of occlusion which is parallel to the mean foundation area. What are the requirements of balancing occlusal unit? The requirements are that it should have contact on second molars when the incising units contact in function, should contact at the end of the chewing cycle when the working units contact, should have smooth gliding contacts for lateral and protrusive exertion. What are the various concepts of occlusion? There are various concepts of occlusions which are divided into two broad disciplines. One is balanced occlusion, the other one is unbalanced occlusion. Under non-balanced occlusion, we have monoplane occlusion and lingualized occlusion. Concepts of unbalanced occlusion was given by Pound, and according to him, the maxillary posterior teeth must have a sharp palatal cusp which occlude with the opposing widened central fossa of the lower teeth to eliminate any deflective occlusal forces. In centric occlusion, he felt that the occlusal contact forces are directed towards the ridge, and hence there is a tendency of shifting of the denture bases towards the balancing side. All's concept features that the artificial maxillary posterior should have a 33-degree cusp teeth, which means they are anatomic teeth and must have full gold occlusal surface, for the masticatory efficiency should be much superior. Hardy's concept felt use of non-anatomic maxillary and mandibular posterior teeth that should be arranged in a flat plane with minimum overbite so that the masticatory forces are directed towards the ridge bilaterally in centric occlusion. Sear's concept was that occlusal pivots were introduced by him, and he felt that to place the mandible in equilibrium when maintaining the occlusal load in the molar area. According to him, the occlusal contact forces also reduced in the anterior region of the residual ridges. Kurtz's concept According to this, it featured that artificial posterior teeth must be arranged incorporating the reverse lateral curve. This concept utilized a posterior tooth block in series of 4 teeth which were arranged on a flat occlusal plane with a reverse lateral curve and posterior ramp. In centric occlusion, these contact forces were directed towards the lingual side of the lower ridge, and in right lateral position, the occlusal contact forces were directed towards the ridge on the working side.